Sometimes the signs of aging are clear. Wrinkles on your forehead, sagging cheeks, but other times are a little sneaky, revealing your age whether you like it or not. Today, Dr. Therese Stubbs is here to help us treat one of those nagging areas, which is the hands. So welcome, Dr. Ann.
Thanks for having me.
So how do your hands really give away your age?
Well, interestingly, a lot of people take care of their face, neck with sunblocks and different creams and things through the years for anti-aging. And then really when you look at especially a woman's hands, you get some thinning of the skin and a little more blood vessels that kind of come to the surface, and pigment, some age spots. So you can kind of see a before and after here of a youthful hand and a little older hand, and you can tell that just by looking.
Okay, and what can be done about this? Because if this is a problem for so many people, we want to know how to solve it.
Exactly, especially when people use their hands talking, or if they're in sales, or even if they have a fantastic ring they want to show off, and they love their hands to look good. So you see here, we see some volume loss. That can be addressed with some fillers in the hands. The thinning of the skin can be addressed by using a good sunblock every day, and some of the retin-A creams can actually build the skin turgor back up. And then wrinkles and age spots can be addressed with both Fraxel laser and something called IPL, which targets the brown spots.
And let's start with the dermal fillers. So how exactly do you go about doing that? Is it painful for people or no?
People find that it's very comfortable. Usually we numb up a little spot right between the two fingers, and just with one tiny little needle hole there after it's numb, we use something called a cannula. It has no sharp edge, and it's a little tube where we can kind of feed the filler into the hand, and it kind of pushes aside the vessels, so there's no broken blood vessels, there's no bruising with it, and it just plumps the skin right up. So usually just two little areas we numb up, we can fill the whole hand with the cannula.
And how long is that going to last?
That depends on the filler we choose. Restylane and some of the hyaluronic acid fillers can last 9 months to a year. Bellafill, which is a newer filler on the market, can last up to 5 years.
Okay, and dramatic results. You can see the before and after, just how much younger that hand looks.
Just getting rid of that kind of veiny or thin skin look does help that.
Okay, another issue people are bothered by, as you mentioned, the age spots, especially on the back of the hand, and that's called hyperpigmentation. What can you do for that?
Exactly, and that's just, usually sun-related. Sometimes hormones play a part in that too. People call them age spots, liver spots, everything. IPL or BBL, IPL is intense pulse light. Some people call it broadband light. It's a flash of light from our instrument in the office, and it basically targets the reds and the browns. So the browns get a little bit browner, and then they just start to fade and flake away in the next 1 to 2 weeks.
That sounds pretty easy.
It is. It's very easy. It feels like a little rubber band snap, but pretty comfortable. Everybody says it's very well worth it, not terribly uncomfortable. Then the only thing you really have to do afterward is put sunblock on. Make sure you stay out of the sun.
You mentioned that a lot, and we always want to tell people, I mean, the best way to do anything is to prevent it. And sunscreen is going to help a lot of that,
exactly,
right?
And especially right after the IPL treatment, we don't want people exposed to the sun because we put a lot of energy in there, and so they can be what we call photosensitive, meaning the sun can kind of affect it a little bit more. I usually tell patients to put just a little tube of hand cream with sunblock in their center console in the car, and then you can kind of put a drop on there and rub the backs together, because really when you're driving, you don't think about that, but you get a lot of sun on your hands when you're out driving around and running your errands.
All right, good advice. And so how do we know which one is going to be best for us if we have a number of issues or one or two?
We always say come in for a complimentary consultation. We can kind of go through all of the different things that there are, and we look at people's time schedules. We look at, are you getting ready for a wedding? Do you have an event, or is this just something you're doing for kind of rejuvenation and for yourself? And we put together a series of treatments and what works best for them and what fits their budget the best too.
And that is leading us to the hand rejuvenation package, which you use the word, that's what you want to do. So that kind of will encompass what somebody needs to do. You're going to offer that.
Right, and this is basically a package of dermal fillers to kind of fill the hands, and also 3 light-based treatments with the IPL. So normally all that together would be around $2,650, and that's going to be $1,800 for daytime viewers. And that's a series of treatments, so they'd see us every month for another treatment on the hands, and all those brown spots could be gone by summer.
All right. Perfect, Dr. Ann. Thanks as always.
Thanks for having me.